right. So I just did your plaque index. And I'll have you look into that mirror and look at where there's color on your teeth.
Okay.
Now pink color is for biofilm that has built up in the last 24 hours. Purple is over 48 hours, and then blue is a little more extreme, like high risk for caries, and we'll get into that. So biofilm in general, that is the bacteria that forms in your mouth. There is good bacteria and there's bad bacteria. Bacteria helps regulate, your saliva has bacteria in it, and your saliva helps regulate your pH and kind of clean your teeth. As biofilm leads to plaque, and you know about plaque, as you've probably heard from other dentists. Plaque is kind of white, sometimes yellow, depending on your teeth, and it builds up on your teeth, and that leads to calculus. And not the math. Calculus is just hardened plaque, and it can lead to inflammation. Now, if that inflammation is under your gums, it can turn into gingivitis. Now, gingivitis, if not properly taken care of, can lead to periodontitis, which is a disease. It's periodontal disease. And that's when your bone under your gums starts to eat away at itself to get rid of that inflammation, that infection. Now, since you are pregnant, that is not good for your baby, especially if you start having caries in your mouth. Maybe you have a sweet tooth. Now, if you're not brushing your teeth, or maybe rinsing your mouth, maybe sipping too much on soda, that can lead to caries, and that bacteria can end up going to your baby, and that can increase your baby's caries risk.
Okay.
So, just keep that in mind. Now, after checking your EOIO, you look pretty good. I saw that you had some fillings, and then you have your bridges.
Yeah, I have a lot of work done.
That's good. And I know you said that previously you did really good with your dental hygiene at home, but since you've been pregnant, you're brushing your teeth a lot after throwing up, and that's actually not good for you.
Okay.
Because that acid that's building up on your teeth erodes your teeth.
Okay.
And when you're using your toothbrush, while it's still on your teeth, you are just scraping away at your enamel, and that's not good because your enamel protects your teeth.
So how long should I wait to brush my teeth after if I do vomit?
So if you do throw up, I would wait an hour, or you can try, I would always rinse your mouth after throwing up. Since you probably do have a higher risk for caries, I would try using a fluoride-based mouth rinse, and something without alcohol as well. Even after eating, you're not technically supposed to brush your teeth until it's been 30 minutes. Just kind of keep that in mind, but rinsing with water is always fine.
Now, does the alcohol mouthwash, does that dry your mouth out, or?
Yes.
Yeah, I noticed that, and it stings, and I don't really like mouthwash, but I will definitely try to start using some.
Yes. And it has been seen, this is common in pregnant women, where your gums do just naturally become inflamed because of all the hormones you're producing. You are, taking care of you and another one.
Okay.
So now I'm just gonna have you brush your teeth for me. I can take that mirror from you.
Oh, yeah, well, I can do that. Okay.
Or actually, I'll have,
Yeah. So you want me to show you how I brush my teeth at home?
Yes, please.
Okay.
Okay. Do you know how long you brush your teeth for?
I do not.
Okay.
How long do you brush?
So usually for 2 minutes, and that's just my teeth.
Okay.
I usually brush my tongue as well, and that'll add 30 seconds, so about 2.5 minutes.
Okay, I've never brushed my tongue before.
Really?
I didn't know that was a thing.
Yeah, so that's actually where a lot of your bacteria builds up, is on your tongue.
Good.
So I'd be very careful, which
Definitely
that's
start
really
brushing that.
interesting because I didn't really see anything on your tongue. And do you floss as well?
Like maybe like once, twice a week.
Okay. And how do you floss under your bridge?
I don't always. I know how to use, I've used the blue ones, but they kind of hurt my gums, you know what I mean, when they poke. Do they have
Yeah.
anything else that's like more comfortable than those plasticky ones?
Are you talking about the loops with like the threader?
Yeah, that I don't like that one.
You don't like it?
Mm-mm. Do they have any other floss setters?
Yes.
Okay.
There are other floss threaders. I actually did bring the one that you don't like here.
That's fine. Okay. Show me how, yeah.
Because then I'm just going to make sure that you're using it properly. So I just want you to show me how you do it. Do you just loop this in?
That's what, yeah, that's, yeah.
Okay. I'm going to loop it in for you, and then I would like you to show me how you floss that lingual bar.
Yeah, just put it in my nose.
And that's just uncomfy for you?
Yeah, I put the bridge,
Gotcha.
and then I just floss it. You just come up and down.
Oh, okay.
You hold that.
Yeah, I can hold that for you.
Yeah. And you just see. I don't know.
Oh,
And then
okay.
when I do my bridge, that's where it hurts. Because I don't know where to put it in. Like sometimes it just hurts. Yeah, sometimes I can put it in there.
Okay.
That's it.
That's not bad at all, actually.
Okay.
I would suggest. I would suggest once you get it through, try and find just one of the sides
Okay.
and pull that through, so you can pull it apart and you won't have as thick
Oh, okay.
floss. That, and it's not really supposed to be against the. I'm gonna have you open your mouth, and I'll point to where you have it. So you have it against. This is called your papilla. It's not supposed to be right there. You want to try and get it sort of closer to the side, and you can kind of get in there. It's actually pretty loose. You can get in there, and that's where all that calculus builds up, which leads to your device and so on. And once you get in there, you're gonna go up and down multiple times. And I'll show you a method. It's called the C-shape method.
Oh, okay. So not just up and down.
Yes.
Okay. Okay.
And another thing is when you go in between where it's not as, where you don't have your bars or your bridges, don't force the floss in between. You want to make sure that you kind of seesaw in, so you can slowly, and try and stay against the tooth, so you're not traumatizing that.
Okay. I've done that
a
before.
regular manual toothbrush or an electric toothbrush.
I use a manual right now.
Okay, that's not bad at all. And actually, that's really good for pregnant women because they usually have softer bristles, and with that, it'll be softer on your teeth because of the erosion.
Oh, so I use a hard bristle toothbrush right now.
Really?
Yeah.
Okay.
Should I not be?
Yes.
Oh, okay.
So maybe a softer bristle toothbrush. It's sort of similar to this one. Was this
Okay.
soft enough for
It
you?
was, yeah.
Okay. Did it hurt your teeth at all?
No.
Yeah. I can give you one after this, and you can start using that.
Okay.
So I would just do the modified Stillman because after seeing your charts, you don't have any perio and you're not a child, so I think you'll be okay with this one. So you would want to kind of just go a little circular, and then you want to brush it up. Sorry.
Okay. For this. Okay. Okay. Okay.
And you kind of want it a little bit angled, a little towards your gums, so you can at least maybe try and get under that. It's called free gingiva. It's a little under your gums, and it's open, and that's where the bacteria really builds up because it's nice and warm and it's damp.
Oh, okay.
So you go, and then you scrape down.
Oh,
And when you're up
okay.
here, you scrape up.
Oh, so instead of me doing it like this, or okay.
Yep.
Okay. Maybe I'll see some better results with that way.
Yeah.
And a soft bristly brush too.
Now, another thing, I can't really show you on this with this, but we have this rounded head, and there's an actual reason for that. It's so when you have your front teeth, the backs of them, you can go like this.
Okay.
And then same thing over here. Yep. And then always just make sure that you get the chewing part of your teeth.
Okay. Okay.
And when it comes down to your tongue, you're always welcome to use your toothbrush, but there are tongue scrapers, and that's really good.
Okay. I will definitely be looking into that for sure.
Yeah. And I can always give you one as well. Yeah, and we'll give you one when you're goodie bag.
Okay.
All right. So now I want to see you brush your teeth.
With how you just showed me?
Yes.
Oh, okay. Okay. Instead of the way I do it. So, okay. So you told me to do this and circular motion and come down.
Yep.
Like that. Okay.
And it's a weird adjustment, but
yeah.
I think it'll be really beneficial for you and your baby. Because we really just want to protect the health of you and your baby. Especially since everything you consume, your baby's consuming as well.
Okay.
Yeah.
Let's see. Up like this. Like after you do the circular, like that. Okay.
And then you go up.
Okay.
All right. Now for the flossing, I'm going to show you C-shaped flossing.
Okay.
You want to get it between your thumbs and your pointer fingers, and you want to wrap it around your middle finger. You want to wrap it more around your non-dominant hand and a little less around your dominant hand. And what you're going to do is you're going to use your pointer fingers, and once you go between the teeth, you're going to kind of seesaw your way, and then against the tooth, scrape up, hop over that papilla against the tooth, and you're just gonna scrape up and down.
Okay.
So I can try it on you so you kind of know what it feels like,
Okay.
and then we can, I don't know if you'll be able to see you in there. Just do this. Yeah. I'm just gonna dip. There we go. So just so you know what it feels like, seesaw, up, down. And if you can see a little bit, I don't know if you can see it or not, but I'm under that patella. So it looks like I'm under your gums, but does it hurt? It doesn't.
Oh. Okay. So not come up and down, do the C shape.
Yep.
Okay.
And that'll make sure you really get
Remove. Okay. Get that out. Yeah.
Yes, ma'am.
Yeah, because like all my fillings, like you get a lot of food stuck in there. So maybe doing the C shape will help remove that instead of coming up and down. So. Okay. I've learned a lot from you already.
Now, do you use any mouthwash? Because I did mention the water and the fluoride base.
No, so what I was saying, the alcohol mouthwash, it just dries my mouth out and it just stings. So I don't like it unless I need to use it to like freshen my breath.
Gotcha.
But maybe brushing my tongue will help that too.
Yeah, I definitely will. I actually have this kind of infographic about pregnancy and how it affects your oral health.
Okay.
Right. So, like I said before, it really affects your baby, and it can lead to preterm birth and low birth weight, and then other stuff such as because of the higher levels of hormones, increased gingivitis and gingival sensitivity. And it does mention the vomiting and not to brush your teeth because of erosion and decay. Talks about how bacteria in your mouth, can lead to your baby. just because you consume it and it's in your bloodstream. It'll lead to your baby's bloodstream. It does give you some toothbrush suggestions, but for now, I would probably just start with the manual since you're comfortable with that.
Okay.
And try that Stillman, the modified Stillman.
Just how you
method.
showed me.
Yep.
Okay. Circular motions, not this way. Okay.
Yes.
I got it. And tongue, and brush my tongue, and C-shaped flossing.
Yes.
Okay.
And alright, so here are some infographics about periodontitis. I'll show you. This one is by Sonicare. So as you see, stage 1, there's not really any bone loss. And the depth of the pocket, that's where your floss would end up going in between. It's like a little free space. It's called free gingiva. And it just rests along the tooth. But if you go down here, look, that's calculus buildup, and it's kind of inflamed, and you start seeing some more bone loss, and it kind of goes from there based off the buildup of calculus. And then we also have this one. This one's for us mostly, but I'll show you. This one kind of is that healthy gingiva to gingivitis and periodontitis, and then perio maintenance, which is when you would come in a couple times a month.
Gotcha.
Yeah. Okay. Thank you. That's great information.
Yeah. Okay, so overall, I think she did a great job. The only thing I would recommend is just having everything together when you go to do your OHI competency with your patients, and just knowing the different adjunctive aids, like flossing techniques, depending on what your patient needs. But overall, she did really good. So,
Thank you.
all right, yeah.